What's up, guys? Ask Coach Ben podcast here. I'm with Jim Lawson, Jiu-Jitsu Magazine. What do you got for me today, Jim?
Hey, Ben. What's up, everyone? So today I want to ask you something that's been plaguing me over time, and I'm sure I'm not the only one. A lot of people can relate. Joint pain. Standard joint pain. It's getting to the point where, man, as you get up there in age, you start feeling joint pain. But then if you're active, it could either exacerbate the joint pain, or sometimes that movement makes it feel better. How do we address this issue of joint pain in our community, in our world?
Okay, so joint pain, I assume you're talking about combat sports, jiu-jitsu.
Yeah.
Okay. So I have a couple notes here for, just how it's kind of a process. If I'm going to explain joint pain, we need to kind of identify what we mean by joint pain, right? So joints are, the connections of your bones, and, they consist of a lot of things, cartilage, muscle, there's a lot of things identify what a joint is, right? So basically, first, you have to make sure that it's a problem that, you don't need to go see a medical professional about. I would say if it's something that's just like a dull pain, something that you got from training jiu-jitsu, I would say even then it wouldn't hurt to go see a medical professional and get that diagnosed, and then what you're working with here.
Well, I mean, that's always a good starting point, right?
Yeah, I want to make sure that everybody knows that, so
Right.
so we don't just go and play doctor on the internet here. So that's the first step, right? Make sure you know what it is. Okay, it could be a lot of things. People experience pain differently, but when it comes to jiu-jitsu, so I've been around jiu-jitsu for 15 years now. I kind of understand what most joint pain is when you're talking about it from a jiu-jitsu aspect. And you're talking about things like tendinosis, right? Like tendinitis, tendinosis. So there's a difference between the two, right?
Okay.
Tendinitis is what people usually call like tennis elbow and things like that. But it's
Whenever you hear itis, it's
Yeah.
it's a form of inflammation.
yes. So inflammation is like tendinitis. Tennis elbow would be more like a tendinosis, where it may not be inflammation. There might be inflammation in there, but more than likely it's tendinosis, meaning that there's like a degrading of the
Deterioration.
of the collagen of the cartilage. So when you have tendinosis, like for example me, right? I've been training jiu-jitsu for a while. My elbows are just creaky. Like if I'm in side control and you put shoulder pressure, I might have to tap. Like that's
Right.
how bad my tendinosis is. And if it's tendinosis, sorry to say, you need to rest. That's the first thing. Joints and things like that, they're not the same as muscle, right? So muscle you can heal sometimes in 72 hours in a short period of time. Joints take longer. Tendons, ligaments take much longer to heal. So that's the first thing, right? Is you just need to rest if it is overuse. Okay, that's something people don't like to hear. But tendinosis is generally just repeated overuse of a muscle or of a joint or of a movement, repetitive movement. And in combat sports like jiu-jitsu, you're doing a lot of repetitive movements, right? Like yesterday I trained, I must have tried to hit like 15 guillotines, right? It's the same motion. So you can get repetitive stress that way. Okay, we'll get to how to deal with it in a second, but I just want to make sure we identify the problem and make sure that we're all on the same page as the definitions, because that's a lot of the times the first problem is we have a different definition.
Right.
You say joint pain, I'm talking about something else. We're not on the same page. Okay. Another important topic we need to cover is the issue of pain versus injury. Okay, pain does not mean injury, and that's a pretty established fact. You can have pain in your joints, but you can be injury free, right? It's not always the case. Usually, when there is pain, there is some kind of tension or injury going on, but we just need to make sure that we understand that, because that's a common thing too, is people will confuse, I have pain in my elbow, I must have an injury, I must be injured. Not always. Sometimes it can be a defense mechanism to the can be an environmental thing. I like to always use the example of people with, they don't have an arm, right? But they can experience phantom limb pain, right?
Okay.
Is the pain in the arm? Can't be, right? It's in the nervous system. It's in the head, right? So pain and injury are not related, right?
Okay.
So a lot of times people feel joint pain and they're like, they come to conclusions, right? My elbow is in pain. I have tennis elbow. Not necessarily. You might just have some tension in your arm from maybe not moving the joint properly, and there's tension in the muscles around the arm that can cause pain, right? This is a complex topic, and I want to make sure that those things are covered first before we get to kind of how we deal with it. Right?
Sure. And one thing I want to address is people may hear that pounding in the background. There's a gym right outside these doors and these walls of us, so people are getting after it, throwing around weight on the outside. So if you hear those booms, we're not under some sort of attack or anything. People getting after it in the gym.
Yeah. There's now we have that kind of identified. We have to now talk about acute versus chronic joint pain, right? So acute pain would be like, I armbarred you in training. I didn't, but let's say I did. Mm-hmm. I armbarred you in training, and your elbow went backwards just a little bit too much, and now you have a sore elbow. You have an acute, meaning a short-term pain from in like maybe an injury, but just something happened.
Okay.
Right? That usually is not what people are talking about when they're talking about joint pain in jiu-jitsu. Most of my questions when it comes to jiu-jitsu come from chronic joint pain, meaning, I've had this knee thing, my lower back, my elbow, my shoulder, it's been like 6 years, and it's just kind of always bothering me. We're talking about chronic joint pain, okay? So acute joint pain is a lot easier to deal with. Take time off, take some anti-inflammatories, do some things to lower inflammation. Chronic joint pain is not always about inflammation. A lot of it is, like we talked about, is the joint is degrading, and so now there's just so many things that could be wrong here. And one of the ways that I recommend fixing this problem, or trying to, you might not be able to fix it. You might just be able to manage it, right? Like I manage my joint pain. I don't expect it to be fixed ever, but I manage it. So there's a wide array of things you can do. So we can just start with a list, but this list isn't. It's not like a this is at the top of the list and this is at the bottom.
Okay.
We will cover what I think people do that doesn't work or doesn't have scientific evidence at the end. But this is a list that I would go through the list, and if it works for you, perfect, right? It might not work for you. Just give it a shot. Okay, so one thing is back inches is eccentric work. Okay, eccentric work has been shown to kind of I wouldn't say heal, but it's generally more regenerative than concentric work. Eccentric work is like when I do a curl, right? Say I do a curl, and I let the weight go down slowly. Okay, that's the eccentric muscle action. So eccentric work has been shown to alleviate joint pain in sometimes. That doesn't always work, right? So one thing I like to do, like, give me an area of that's bugging you right now, Jim.
Oh man, I'm a walking area of pain, but we'll say with my knee.
Okay. So
knee.
with the knee, knee's a little bit more complex, but
or we'll go with shoulder. Well, shoulder's pretty complex.
No, let's stick with knee. Let's stick with
okay.
knee. It's fine. So a knee, right? An eccentric. So I first identify what it is. Do you have lateral knee pain? Do you have anterior, medial? Where is it? Okay, but where is the knee pain?
That's a great question.
Inside, outside,
it's
or in the
inside.
front?
Inside. Like it feels like it's inside the knee assembly group.
Okay, and then let's say you have the knee here, right?
Uh-huh.
Is it in the front, lateral, or medial?
No, I would say it's dead center.
Center.
Right underneath the kneecap.
Okay.
In the center.
So, eccentric work for that type of pain would be, and I can also say isometric work kind of falls in here too. Isometric meaning you hold something for a contraction.
Okay.
Right. So, as a strength coach, when somebody has anterior knee pain, it's minor. It's not like severe, we do this exercise called TKEs. Okay, TKEs are terminal knee extension, right? And what it is you guys have to look it up. It's kind of hard to explain in audio, but you put your leg through a band, and then you back up, and then you just stomp that leg into the ground until you feel that your quad is kind of lighting up. Okay, your quad is firing. Okay, and this is not quite eccentric work. This is more like isometric work, but it's strengthening the quadriceps muscle, and so along with eccentric work, it's strengthening the muscles around the joint, and that can help with joint pain.
Okay, yeah, which brings me to, and I don't want to kind of side rail your train of thought, but you mentioned some of the ways to approach joint pain is to possibly strengthen up the tissue surrounding the joint in question, right?
Yes. So like another way would be like if you use like a leg extension machine, right? You use leg extension, but you use two legs to do the concentric or do the forward motion, and then the negative motion you come back and you only use one leg, right? So now you go very slow with that one leg, and that would be eccentric work. And if your knee's bugging you, that's something to try. May work, may not. That's just one thing. Eccentric work, right? So lowering the weight slowly in the weight room, or really you have to use weights here, or body weight.
So would it be appropriate to say that eccentric work means the extension of a joint, like opening up the joint, whereas concentric is the constriction where you close the distance? Like a curl, like a bicep curl would be considered a concentric motion. Correct?
Some exercises are the opposite, though. Like squats would be the opposite. So the concentric, you're extending all your joints. So I wouldn't use that example, but a curl would be different. You're when you're extending your arm out, you are doing the eccentric.
The eccentric motion of the curl, right?
And when you are contracting, it's based off of muscles, not joints. So that's why it gets complicated, right? When the squat is in reverse, everything's in reverse, because the eccentric is the lowering. So when you go down to the ground,
you're actually constricting. You're balling up,
contracting.
So contracting. Yeah. Okay, understood. I was just trying to figure out a good, easy method to distinguish eccentric.
I think
from
I used the
concentric.
wrong word there. Not contracting. You are shortening.
Sure.
You're shortening. So
fair enough. It's not extension.
Yeah, you're flexion. So when you're going down, everything is going into flexion.
Okay.
And when you're going up, everything's going into extension. Knees, hips, ankles.
Gotcha.
It becomes the opposite in certain exercises. So, yeah. So along with eccentric work, that was the first one. Right.
Okay.
It doesn't mean it's the best. It's just one of the things. Another thing you can do is just working the joints through all of the motions. Excuse me. That the joint can move through, right? So it's easy when you use like hinge joints, like the elbow and things like that. There are certain joints that they don't have many motions, so it's very easy to do, right? Like the shoulder is a little complicated because there's so many. There's a scapula. There's upward, downward rotation, abduction, adduction. There's a lot of movements. And you got to hit all those movements, right? Most people, like if I use the shoulder as an example, if I say to a person, do upward rotation, they don't even know what upward rotation is, let alone do it. They don't even know what it is. So there's certain things you can do. There's I went to this course a long time ago, functional range conditioning, FRC is what it's called. And they're all about moving the joint through a full range of motion. Like this is one of the exercises that they do. You rotate in a circle. They're called CARs, controlled articular rotations. And, it's a system, right? I think it's great. If you guys just look up how to do CARs, C-A-R capital, and then small s, that's kind of their system, right? And you don't have to use their system. You can just study every joint and see how it moves, right? And a website I use is exrx.net. Okay, so exrx.net, if you type like shoulder articulations, right, it'll tell you how many movements of the shoulder are possible, and you just want to move yourself through those ranges. and it just improves your movement quality, and it might improve the joint pain. But I will tell you that it will improve your performance if you're able to keep up with it. So that's one thing you can try to moving through a full range of motion. These are all like mechanical things that you can do, right? We're going to get into things that are non-mechanical now, like things that are like supplements, for example. It's not mechanical. But one other thing that's kind of like in between is, and I did this recently, donating blood. Okay, mm-hmm. Donating blood. People might think, oh, well, what does that have to do with joint pain? Well, as men, right, we have no way of getting rid of iron storage in our body, right? Most of us don't. And so ferritin is a cell inside the body that stores iron. Okay, so when you have a high ferritin level, not only is that just generally not good, it's a toxic thing, you can experience joint pain. So recently I went and donated blood, and this might be placebo, but my joint pain went down. Like elbows feel good, shoulder feels good, hips feel good.
But whether or not it's placebo, there are at least things to point to that suggest why you would feel
There's
better.
mechanisms, yeah. So there's scientific evidence that tells you not only is lowering ferritin levels in the body good for your heart, right? It decreases heart disease by like 30%. There's a study out there on this. There's decreases your fatigue. So if you're just tired during the day for no reason, and it's your energy levels, it might be high iron. High iron, high ferritin also can increase your inflammation in the joints, and that can be a chronic thing, and that can cause joint pain like this. I can explain it like this. Every couple of years, if I don't donate blood, I have this like stinging joint pain in my fingers and elbows especially. That, again, may not be the exact cause. That might not, who knows, right? Maybe just the thought of I'm doing something that I think is going to work might actually work. Mm-hmm. But either way, it doesn't hurt. You actually help people. You're saving people, right? So donate blood, give it a shot, decrease your ferritin levels in the body. There's something about me. I don't like chicken. So guess what I eat all day?
Steak.
Yes.
Cow.
Yep. Like I do not eat chicken unless it's fried. But so I end up eating just way too much iron a lot of the times.
Okay.
And so donate blood.
So before we move on beyond donating blood, what do you think is a general barometer of how often you should donate blood? Is this a once a year thing, twice a year thing, generally speaking?
That recommendation, I'm not too sure, but I would just do it twice a year.
Twice a year.
Twice a year is pretty good. I think you have to wait, like it's like 3 months or something. Is like I don't know the exact. I think it's close. They want you back every 3 months or whatever.
But at least once or twice a year, especially if you're an active athlete of some sort.
And I'm going to be honest, I'm not doing it to save people. I'm trying to. Well, that's just the honest truth, So I don't want to overdo it. Right. I don't want to overdo it and actually be on the lower end. I just want optimal levels. I'm trying to. It's just a byproduct. It's good for me. It also helps people, and that's great. But primarily I'm doing it because I want less joint pain. Okay. All right. Couple more. So I'll get to supplements at the end because I think it's something that you should really try last. I feel like supplements is not something that you should go and just spend money on because it costs money.
Well, it's exactly what the name says. It's a supplement to what you're already doing, what you should already have in place.
Yeah. So before that, right, this is one I have problem with this also. Eat more veggies, eat more fish. Okay. Fish is anti-inflammatory. It's got omega-3s. Good for your heart, good for your joints. The general recommendation is to eat fish 3 times a week. Fatty, oily fish. Okay, so salmon, mackerel, raw tuna, the yellowtail. There's certain. Just look up. I have like a graphic on my Instagram that tells you what fish is oily and what fish is lean. So eat oily fish. So that's why salmon is so good for you. Salmon is actually one of my favorite foods for during a weight cut because it's so it's nutrient dense. There's a lot of magnesium, and salmon generally is what I would recommend for fish. Other oily fish are great too. Just stick to oily fish as opposed to lean fish. Okay, so a lean or a white fish would be like tilapia, right? So tilapia, not the greatest for health, So it's just a protein source. And then veggies, right? Most people do not eat even close to the recommended serving size of veggies, right? Mm-hmm. Leafy green. The general recommendation is to eat as much color as you can. Eat the rainbow.
Eat the rainbow, yeah.
So, like, I'm horrible at this, right? I eat meat and rice and eat like 2 pieces of kale, and that's it.
Call it a day.
Whereas I should be having the kale salad and then eating the
sprinkling.
Then eating meat and rice, something like that. Okay, so eat more veggies. Okay, generally people don't eat enough vegetables. I don't know the exact recommendation, but just eat more. Okay, eat more veggies. Okay, it's all and this is a side note. People will try to get their veggies in through supplements or green powder, like you've seen the green powder, Jim.
Yeah. Yep.
One of my mentors, Alan Aragon, I've talked to him extensively about many nutrition topics, but this is one of them that he's kind of told me it's not the same. The green powder and the vegetable is not, they're not even in the same realm, actually. So if you're going to eat the green powder, you're kind of, you're hoping, you're wishful thinking. Just eat the vegetables. Just eat them. Yeah, eat them. So that's, side note, people will try to, a lot of athletes that I work with, they just do the powder because they don't like to eat the vegetables. I always tell them, just don't even do the powder. Okay, just eat the vegetables. Okay. Supplements. Next thing in the checklist, supplements. And this is where, even though I'm putting it later in the list, this is something that if you have the money, if you have the funds, just get right into it. There's nothing, you don't really lose anything except money, but if you have the money, do it. Okay, so a couple supplements that I use personally, things that I think help joint pain or help improve joints, collagen. Okay, so collagen is pretty popular nowadays. There's some good evidence on it, and I wouldn't say it's concrete yet, but just mix it into your protein. I think I've told you to take it several times. Just mix collagen into your protein shake post-workout. And there was like a study on it where they took a bunch of collagen and vitamin C right after a workout, and it showed improvements in the joints. So again, it just, for me, collagen is good because it makes my protein have a little more protein, has more protein content. Now, I wouldn't recommend taking collagen as a substitute for protein because it's not quite at the quality of like whey protein, for example, but you can add it into a whey protein shake and it'll be pretty good. It'll take your protein shake from 30 grams to like 40 grams or something, right? And collagen is just it's in your cartilage, and it's a supplement that I recommend. A couple other supplements, vitamin D, vitamin K. These are generally supplements that people are deficient in anyway, and they have some function with helping joints. Turmeric, I think is very good. You take turmeric, Jim?
Not as much as I should, but we definitely have some. The wife loves turmeric.
Yeah. Anti-inflammatory.
Right.
There's a lot of health benefits outside of joints. I take it twice a day, first thing in the morning and then at night, before I go to bed. And, I think it's got good research. Good research is behind turmeric. Curcumin is the other term for it. Relatively cheap. It's not super expensive.
They even have juices infused with it, which the wife likes as well. So it's easy to find.
So one thing with turmeric is its absorption is pretty poor. So you have to take it either in a pill form that has some kind of blend in it, or you have to take it with black pepper, which is also a blend.
Really?
Yeah. So
okay.
Its absorption is horrible. So you need things in it that'll help absorb into the intestine. And that's usually black pepper, or there's like brands that have
now,
it.
How about people that cook with it? Does it lose some of its efficacy?
I don't know the answer to that question.
That's a Mateo question.
Probably.
Let's get him on here.
Yeah. Let's
And
talk to a person that's a little more, because I don't know. There's like when you cook, you're adding heat to the thing.
Right.
I'm not 100% sure. It's like
Okay.
like if you, this is a weird thought, but like if you take creatine, right, and then you sprinkle it into your food and you cook it, like does the creatine still work? Is there still like an effect? I'm not sure. Like I don't know how that works. I'm not a chemist. So yeah. Okay, so those are the main ones that I would recommend. Collagen, vitamin D, vitamin K, turmeric, fish oil. Right? If you can't do fish, you don't like fish, you don't have money to eat fish or something, just take fish oil. The quality of the fish oil does matter. So it's hard for me to, I don't know where everybody lives, but a site that I think is relatively trustworthy is Labdoor. If you go to labdoor.com and look at their ranking of the quality of fish oil, you don't want rancid fish oil. I always recommend when you buy fish oil, take a bite into it, and you'll know if it's rancid or not. Okay, take a bite.
That's a tough proposition, there, Ben.
People
Biting
take
into fish oil.
If you go to like Whole Foods or something, they sell like the oil where people take shots.
Right.
So it can't be. I used to do that actually. I used to do that to save money because the pills cost a ton.
However, there's the Barleans. I don't know if you're familiar with.
Yeah,
that
I know the
brand.
brand.
Oh man, now they have done it right. They make it very, very tasty.
The oil?
Yeah, the lemon flavored Barleans fish oil. That's legit. I even had my kid taking it, and they love it. So
Really?
if you ever get a chance, try it. Really good. And they have flaxseed oil and all that stuff. This is not a commercial for Barleans or anything, but it's legit. The taste is legit. It tastes like an actual treat.
Yeah, we don't have any sponsors, so
like jelly donut. Yeah, so any
Barleans
sponsors out there,
hit us up.
Right.
Right. Yeah. So let me get into so those were like the traditional, like easy supplements you can find over the counter. There are esoteric like out there supplements that I don't recommend per se, but I would say if you have the money and you're kind of out of options and you want to try everything, why not, right?
Okay.
So there's I'll start from, I guess, the most innocuous ones. There's this herb, also pill. It's like turmeric, I guess, similar effects. It's called Boswellia serrata. So it's just a supplement that has some scientific evidence behind it for joint pain. Another one is, I already recommended collagen, but there's also type 2 collagen. So type 2 collagen is like a different form of collagen that is usually in a pill form. I take it. Does it work? I don't know. Some evidence behind it. Who knows, right? Microlactin is another one. Microlactin is like a milk protein, I believe.
Okay.
Well,
anything with the word lactin, right?
Yeah,
Fair.
it's pretty expensive, but there's some evidence behind it. I've tried it. Don't know how well it works.
Okay.
Ciseus is a supplement that was really popular back in the day. It was like it had a lot of evidence on how fast it would heal bones and things like that. Ciseus, yeah.
Okay. Now,
Ciseus.
again, just to reiterate, these are in your
Esoteric.
opinion, fringe,
yeah.
Okay.
These are things that if you have the money,
go for it.
go for it.
Okay.
At worst, you get some placebo effects,
And that's
right?
an effect.
Hey, whatever. If it works, who knows? I had a friend who took Ciseus and said it was like the greatest thing ever. He recommended everybody. I don't recommend it to everybody, but it worked for him. He said that was the cure.
So there you go.
And there you go.
Okay.
What harm, right? Except money. The last one of these esoteric ones. This is one that we're going to talk about this, but just be careful with this type of stuff. Okay. BPC 157 is a compound. It's an injection. You inject it into the joint or into your your fat.
Adipose.
Yeah, adipose tissue, and you inject it, and it's supposed to have a very strong.
Painkilling effect, right?
Just a healing. From what I've read on the internet and from I have a doctor that even recommended it to me. It works for some people like magic, but you have to be okay with injecting yourself. So if you're okay with that, it's a legal compound. You can buy it on the internet. BPC 157.
Illegal, as in it falls within law.
Yeah, you can buy
use.
it. Yeah, but you have to be very. You have to know what you're doing. Okay, like if you do this, just heed my warning. Do not play around. This is stuff that is like on the edge of supplements. We're almost in anabolic steroid and growth hormone territory here.
Okay.
And that's the other thing that I wanted to get into and talk about, because I think it's important to cover. People are going to do it anyway. Might as well
Put it
let
out
them
there,
know,
yeah.
right? So, anabolic steroids and HGH, right?
HGH, human
growth hormone. So let's start with HGH. Okay, HGH, I'm almost certain has healing effects on the body. Okay, how much so that there's not a whole lot of evidence. There's some evidence out there that actually doesn't work. Certain people that have high levels of HGH, it doesn't work for them. Something like that. But again, this is something that's very expensive. Like me and you, to get HGH, it would cost us a lot of money. Like it's usually something that's not covered by insurance. It's very expensive. I think it's probably like in the thousands of dollars for like a 3-month supply. So
wow.
So yeah, and again, it's out there. Like I know people in jiu-jitsu that do HGH, and so does it have healing effects? Yes, but do you really want to go there? It's just, there's a lot of side effects, and it might not work, and it's very expensive. We're not talking about supplement expensive now. We're talking about like medical expensive. They might actually suggest it. I know some doctors will. And then anabolic steroids. So we're talking like nandrolone. We're talking like just testosterone is kind of like a base for all that. It's probably going to help, right? To be honest, it's going to help healing. But again, side effects, you're gonna mess your dick up. I mean, there's just certain things. Is it worth it? I would say no. If you're gonna do, if healing your joint pain or just dealing with joint pain is that serious, you need to take steroids. I think we've gone too far here.
Now, what do you think the climate is out there in this day and age? Again, when we want to work under the assumption that people are responsible in their use and what they want to do, and that they will approach everything from what we're talking about here, the supplementation, to, like you said, we're kind of venturing into the medical side of this issue, medical treatment. Are there doctors out there that would prescribe some sort of anabolic steroid protocol to treat joint pain that you know of?
I don't know of any doctors that would do that to treat joint pain.
Yeah, so when you talk about, seek medical advice, it's like,
HGH is a little different.
HGH is a little different. But now we're talking about anabolic steroids. So as far as you know, there probably isn't any doctor that would administer this, when this is something that a doctor should have eyes on, your medical records, to your cardio health, your cholesterol, all that stuff, because anabolic steroids affects all of that, your hormone levels, all that, right?
Yeah.
So, I mean, I guess the question is how would one even seek medical attention if they walk into a doctor's office and say, I want anabolic steroids for whatever reason? It's like, do you know of any, like, a doctor that would prescribe this type of treatment?
So use this advice, not advice. It's not advice. This is just facts. This is just facts.
Okay.
There's a lot of TRT mills in everywhere now. Okay, like
now, is TRT considered anabolic steroids, or is this a whole
testosterone? Testosterone is. I'm not too sure about the classification, but yes, you are injecting an anabolic compound into your body, something that is naturally produced in the body. That you will suppress when you inject testosterone. TRT is basically just an injection of like 100 milligrams of testosterone on a weekly or bi-weekly basis. And the idea is to get your testosterone to its natural levels. Mm-hmm. And these are usually for people with low testosterone. But guess what? Let's be honest. People are abusing this shit. Sure. So there people in the UFC, they were on TRT. I mean, I hope I'm not breaking any news here, but I mean, most high-level competitors in jiu-jitsu that are not, I shouldn't use the word most, a lot of high-level competitors in jiu-jitsu are using testosterone. I know female competitors that are injecting testosterone on a weekly basis, just for recovery, joint recovery. So yeah, these are things that it's out there. Do you want to mess with it? I would say it's not worth it. There's a lot of side effects. There's a lot of things that happen. Does it help with joint pain? Does it encompass the topic? Probably yes.
There's science that suggests yes, it does. It does help.
Yeah, I would it increases the tissue turnover. So yeah, it should. There's no reason that it wouldn't. I haven't seen the actual data on it, but just by how much muscle mass you're going to gain, there's a correlation there. Okay. All right. So again, most of this stuff is just knowledge. I'm not a doctor. I'm not telling people to do certain things. I'm not even telling you that any medical advice. Right? Go to your doctor. This is just I'm just making noise into a microphone. So there's a lot of things that people do. I see it all the time, and this is the last item that have pretty much no scientific evidence. And I'm sure the list is longer than even the one I made. But they tend to do it, and it works for them. Maybe it doesn't work for them, but they think it works. And my take on that is placebos do have an effect. Like, placebos can work. Now, I don't recommend placebos because it's just irresponsible. Like if I recommend to you cryotherapy, right? I'm not going to say cryotherapy is a full placebo, but the science does not really support its use right now. There's just no rhyme or reason either, So, like if I say, hey, Jim, you have knee pain, you have elbow pain, you have shoulder pain, whatever, go do cryotherapy, right? And you do cryotherapy, and you're like, oh, Ben, it's awesome. I'm all healed. It's all good.
Who are you to say at that point?
It works. But at the same time, we have to base our recommendations off of science, the strength of the scientific evidence. So that's not the first thing that I would tell you to do. Like, if you did everything on this list, including steroids, and then you were like, oh, none of this works, I might be like, okay, Jim, I have this thing, cryotherapy, go try it. And then you do it, and lo and behold, that was the thing, right? It may have worked. It might have been placebo. It might have been, your brain developed some effect, whatever. Who cares? If it works, it works. I'm not going to recommend it, but like, some people will come to me and be like, oh, I had an elbow injury, but I went to cryotherapy and it's all healed. I'm not going to oust them as like, you're dumb for doing that, because it didn't. There's no scientific evidence, because it worked for them, right? So there's a lot of things that people do that don't have scientific evidence. I'm not saying they're bad, but especially when they cost money, when they cost you money, I would be careful with them. Okay, like cryotherapy is one of them, right? It's very expensive. It's not cheap. Over here we have it down the street, $60 a session. Okay, if you're spending $60, you could get like a lifetime supply of turmeric.
Right.
Icing, icing doesn't have a whole lot of scientific evidence for chronic pain, for chronic joint pain. Icing is good for immediate inflammation. Action. Exactly. You popped your elbow in a arm bar and it's swollen. Okay, ice, inflammation. You got to control the runaway inflammation there. That's important. And then there's also supplements that generally have like very, very poor scientific evidence. Like, it has like systematic reviews, which is like a group of a lot of studies, have shown that it doesn't really work, but people still buy it. It's like a multi-million-dollar glucosamine, right? You've heard of glucosamine, sure. Chondroitin, shark fin stuff.
Right.
So glucosamine, I've heard people describe it like this. It's like if you put, what is it, like 87 gas in your car and 91 gas in your car, okay. Right? If you have a regular car, like, can you tell the difference? No. Probably not, right? So it's like a couple percentages. Right. So if you use glucosamine, that's generally the best effect that you're going to get from this scientific evidence. You're just going to get a couple percentages of benefit. I've taken glucosamine. I've probably spent at least $1,000 on glucosamine in my life. I'm serious. Right. I used to take it for like 10 years straight.
Right.
I can't say they did much. Right. I can't. And there's also theories out there about like how it's it's actually the sulfate content in glucosamine that's working. There's a lot of funky stuff. So those are a couple things that a lot of people do. They don't have any evidence, like acupuncture, things like that. They don't have any evidence. But if it works, great. right? Can you think of anything else that people do for joint pain that's like, you know, might
No,
not
I mean
have
the
any evidence?
glucosamine. The glucosamine is really the big one. That's, to me, I think that's the most common. If you hang out with anyone or if you're around gym, spending time.
What do you do about
around gym.
joint pain?
Oh,
Glucosamine.
bro. Yeah, twice a day, 6 pills a day. You know.
Yeah, you see, the thing is, it's great and it might work, but when you go online, you search for scientific evidence.
Oh, here
none.
you go. Okay. What about topicals?
Okay, so that's actually, since we already talked about kind of anabolic steroids and HGH, we can talk about topicals. So
Topicals being like lotions,
yeah,
the
CBD,
Bengay, yeah.
things like that.
Yeah, there you go. CBD is
CBD.
like a huge thing right now.
Yeah, so I left CBD out of my list because there is not a whole lot of evidence behind CBD and joint pain. There is some evidence that CBD can decrease inflammation, but again, we talked about this in the beginning. A lot of chronic joint pain isn't inflammation. It's the degrading of the joint, of the collagen. So CBD, people have used like a panacea, right? It fixes everything. It cures cancer, cures AIDS.
Right.
And I'm making these things up.
Right.
Takes your joint pain away. You're going to be healed overnight, and your mental health is going to be...
You're going to be genius.
Yeah, and you're
next
so
Elon Musk.
that's the problem I have with things like CBD, right?
Or
CBD,
at least the claims. That
yeah,
people
the
claim
claims, it gets
CBD's
crazy.
not the devil. It's the claims.
I've talked about this before, but this is capitalism, right? People like to something that works for them, or they see a function for it. They want to make it into this product. And what happens when you make something into a product? You now have to make claims.
You have interest.
Yeah.
Right.
Now these claims, they don't support the science. So CBD is great for, like things like tumors, right? Like there's some, it shrinks tumors in cancerous cells. That's kind of been out there already. There's evidence behind that. There's some evidence on inflammation. There's definitely some evidence on sleep quality. It helps people sleep, but it's not like a panacea. And also CBD is not cheap either. Sometimes it can be pretty expensive. Topical CBD, right? I use it. I don't see any reason not to. It's just, does it work? Who knows? I'm kind of hoping it will work. Okay, and I don't use it all the time. I have a lot of CBD companies just send me stuff, and I'm just like, oh, put it on, and it's okay. If it works for you, keep doing it. If it's working, do it. Okay, as long as it's not costing you anything like a whole shitload of money.
And that's your general take on things. If you feel it's working for you, by all means, and indulge.
Yeah, I'm like in the middle there. So
Okay.
if you're already doing it and it's working, everything's good. Continue. Right. If you're trying to look for new things, you don't want to go in with quite that attitude, because then you could be
spending a lot
more money just chasing your tail.
Hey, that supplement life gets expensive.
Other topical. There's like a lot. You could topical anything. You could probably topical like turmeric if you wanted. But this is something. Again, this is talk to your doctor. Talk to your doctor. This is something that in the U.S. is RX. It's prescription. It's called diclofenac, or Voltaren gel is its kind of like its brand name. So it's like Voltaren would be like Viagra would be like, that's the brand, right?
Okay.
But Viagra is actually like sildenafil or something
Yeah.
like that. So diclofenac is the name of the medication, and Voltaren is the company that is like the name brands, like the Kleenex.
Okay.
So Voltaren gel, I recommend this. No, I don't recommend this. Excuse me. If I was a doctor, I would say it's something good to have in your pantry for acute injuries. Okay, chronic, there's some evidence that it works. There's some evidence that it doesn't. Voltaren is basically just a topical anti-inflammatory. It's like a topical naproxen. It's a topical ibuprofen. Okay. So anytime I have a tweak, I'll rub it on, and it'll decrease the inflammation, hopefully. But yeah, talk to your doctor. You can actually get it legally over the counter in Canada, I remember. So if you go to Canada, just stockpile it up and drive back.
I'd assume Mexico too, yeah?
Yeah, well, you could probably get anything. Yeah.
Right.
So
Not saying we're not saying you should cross the border to illegally access things and cross the border with it.
So Voltaren gel, I'm a believer in it. I think it's great for, again, but that's mostly for like chronic, like acute injuries. Chronic, it may or may not work. And then so that was something that does work. Okay, that's something that I believe does have scientific evidence. Okay, we were talking before that about things that don't have much scientific evidence.
Okay.
So yeah, I think we covered a lot of them. The things that don't have much scientific evidence: cryotherapy, icing, like your elbow's been hurting for a year, so you've been icing it the whole year. Like at that point, ice ain't gonna work. Heat may actually benefit you more than ice. Because a lot of the times pain is created by tension in the body, right? Like if I'm constantly tense and you're going to develop some pain there. You know? Like here's a good example that has recently helped me with a chronic issue that I've had. I've had lower back pain since the beginning of time. So one of the things I noticed was that I tend to lean away from my low back pain. So like say I have low back pain on my right side, I like to lean to my left side to hopefully alleviate
to compensate.
Right? That's actually the opposite of what you should do, because let's see, when you lean to your, just do this for me real quick, Jim. Lean to your left side. Okay, when you lean to your left side, feel your low back, your spinal erectors. On your right side, you should feel that they're lit up. They're kind of on. They're activated, right? And on the side that you're leaning, your left side, it should feel like they're kind of shut off. Okay. Right? Do you feel that at all?
Yeah, it makes sense.
Yeah.
So because it seems like it's trying to compensate and support.
So now, if my right erector is always tight, right? It's always on. There's always tension, and I keep leaning away from it. I'm turning it on more. I'm creating more tension. So something that's helped me recently is just to decrease the tension by leaning more into the side that I have that low back pain. And see, now when I lean to the right side, you can tell it kind of shuts off that erector muscle, and it's not constantly firing, So a lot of joint pain at the end of the day could be just this constant firing, this constant tension of the muscle that never gets shut off. Even when you're going to sleep, it's probably turned on. Mm-hmm. So yeah, that there's hopefully that was enough actionable items, enough practical things that you guys can try, and yeah, I think we covered most of that topic. It's a very complex and broad topic, joint pain. There's a lot of things here, and not one of these items on the list might be able to fix this problem, but it at least gives you actionable steps to start taking. And I want to make this very clear. Rest is one of the biggest things, right? If your joints are in pain, much of the time it's because you've overused that joint, okay? Especially if there's no injury, right? So, anything else, Jim?
Rest? Nope. We got it. So, rest is the paramount. Condition the surrounding tissue, work on the surrounding tissue of a joint.
There's two things you can do. There's mechanical things you can do, and then there's like diet things that you can do. I would do both. Right. I would do a good place to start would be to do eccentric exercise with your weightlifting, and then on top of eccentric exercise, you can go and donate blood. Right. Donate blood. Right. Then you can also add in turmeric. Right, you can add in, let's say you add in vitamin D, vitamin K, turmeric, and collagen. Okay, you add in those 4 big ones, and then you also decide, hey, I'm gonna go and I'm gonna try fish oil too.
Well, it sounds good. Yeah, I think we wrapped up some good major items to start with and to work with for people to address their joint pain on their own. If they have any more questions about joint pain or anything else, nutritional, strength and conditioning wise, or even jiu-jitsu related, I guess they could post something on any of the social media platforms. Use the hashtag AskCoachBen. And yeah, maybe we'll see it, and then we'll start addressing some of these items.
Yeah, you can also message me on Instagram at Coach BZ. You can message Jim at what is it, Jim?
So yeah, what we'll do is we'll create these questionnaires randomly. We'll figure out a schedule, but we'll put these Instagram stories of we'll have an Ask Coach Ben session, and we'll gather some questions there as well. So Jiu-Jitsu Mag on Facebook, or Jiu-Jitsu Magazine, Jiu-Jitsu Mag on Instagram, and then Jitsu Mag on Twitter. So, or you just go to jujitsumag.com and get it done right there.
One last thing, they're not a sponsor yet, but thank you to the Iron Neck for sending me one of those, and I'm going to test it out and give it a shot and see how that goes and come up with some exercise for it. Thank you.
Iron Neck, and a big shout out to Muscle Farm too.
Muscle Farm, of course.
The Muscle Farm community really allows us basically a playground to test a lot of these modalities and theories and things like that.
Yep.
So, very good, Coach Ben.
Thanks, Jim.
All right.